Question 1. A nurse has instructed a 63-year-old female with a new prescription for captopril, carbo-10, for her hypertension. The nurse realizes that the client needs further teaching when the client states, B. I will use a salt substitute. Captopril, carbo-10, is an angiotensin-converting enzyme, ACE, inhibitor prescribed for hypertension, congestive heart failure, and diabetic nephropathy. Clients should not use salt substitutes because they contain potassium, and ACE inhibitors cause the body to retain potassium. The other responses are appropriate. Question 2. During the first stage of labor, which phase results in the formation of the birth canal? A. Transition phase. By the end of the transitional phase, a birth canal will have formed. This is a single passage of the open womb, cervix, and vagina for the baby to pass through. During the latent, early, phase, the cervix dilates to about 3 cm, 1 inch. During the active phase, the cervix dilates to about 8 cm, 3 inches. The transition phase ends at 8 to 10 cm, 3 to 4 inches, for the fetus to pass through. Delivery is the final phase of stage 2. Question 3. A father calls the poison control center after discovering that his 3-year-old son has taken 12 grape-flavored chewable acetaminophen tablets. What should the nurse instruct the father to do? C. Quickly go to the emergency department. Acetaminophen overdose carries a risk of severe liver damage. The child needs to be evaluated as soon as possible at the emergency department. The other options are not appropriate. Question 4. A patient diagnosed with trichomoniasis is being treated with metronidazole, Flagyl. When teaching the patient about this medication, which of the following will the healthcare provider include? A. Do not drink alcohol while you are taking this medication. Trichomoniasis is a common sexually transmitted disease, STD, caused by a protozoan parasite. Treatment is with oral metronidazole, Flagyl. Drinking alcohol while taking metronidazole can cause a reaction similar to disulfiram, antabuse, which is characterized by nausea, vomiting, abdominal cramps, headaches, and flushing. Hepatotoxicity and tendon inflammation or rupture is associated with quinolone antibiotics, such as ciprofloxacin, Cipro, or levofloxacin, Levaquin. Dairy products and some antacids can interfere with tetracycline absorption. Question 5. Gestational diabetes mellitus, GDM, is usually managed with C. Nutritional therapy. Clients with gestational diabetes mellitus, GDM, can usually control their glucose intolerance with diet. Oral hypoglycemic medications are contraindicated in pregnancy. NPH is rarely necessary for blood glucose control with GDM. Question 6. According to the World Health Organization, WHO, a neonate has the highest risk of dying. When does the neonate phase end? C. After 28 days of life. A newborn infant, or neonate, is a child under 28 days of age. During these first 28 days of life, the child is at highest risk of dying. Question 7. During her first prenatal appointment, a 24-year-old primigravida asks the nurse how the doctor could tell she was pregnant just by looking inside. The nurse explains that she had a positive Chadwick sign, which is B. A bluish color of the cervix and vaginal walls. Chadwick sign is a characteristic bluish-purple coloration of the cervix and vaginal walls, visible at 6 to 8 weeks of pregnancy. It is caused by increased blood flow to the area. Question 8. To assess cranial nerve 7, the nurse should ask the client to do all of the following except C. Extend the tongue. Cranial nerve 7 is the facial nerve. The client should be able to smile, raise eyebrows, and puff out cheeks and close eyes without any difficulty, as well as distinguish different tastes. Extending the tongue is controlled by cranial nerve 12, the hypoglossal nerve. Question 9. A high school student comes to the teen clinic to ask about using condoms for safe sex. Which of the following statements is most important to stress to the client? C. Leave a half-inch space at the tip of the condom. The client should be instructed to leave a half-inch space at the tip of the condom where semen can collect after ejaculation. This also prevents the condom from breaking. Condoms are a good option for preventing pregnancy and sexually transmitted infections, STIs, because they are affordable, easy to get, and the client does not have to plan ahead before using them, other than to carry a supply. When used properly, condoms are about 98% effective in preventing pregnancy. The safest are latex condoms with nonoxynol 9 as a lubricant. A new condom should be used every single time. Petroleum jelly, baby oil, or body lotion can weaken the latex and cause the condom to break. The condom is removed before the penis gets soft to prevent sperm leaking out. Question 10. The healthcare provider, HCP, orders an alpha-fetoprotein, AFP, test for a pregnant client. When the client asks the nurse about the purpose of the test, what is the nurse's best response? C. AFP is a blood test that can identify possible birth defects. An alpha-fetoprotein, AFP, blood test is generally performed between 15 and 20 weeks gestation to check the level of AFP in a pregnant woman's blood. AFP is a substance made in the liver of the fetus. The AFP level in the blood can help determine neural tube defects such as NBSB, spina bifida, meningocele, and NBSB, and NBSB, anencephaly. Question 11. When a home health nurse reviews her client's schedule for the day, which client is most at risk of abuse? C. An 84-year-old woman with advanced diabetes complications. The typical abuse victim is an elderly woman with few social contacts, at least one physical or mental impairment, and dependence on others for daily care. Often the abuser is a family member or caregiver. For this question, the 84-year-old woman with advanced diabetes complications will rely on others for glucose monitoring, diet, and assistance with activities because of complications such as impaired vision, peripheral neuropathy, or circulatory issues that could involve amputation. Question 12. When parents bring their healthy 2-week-old baby to the pediatric clinic for a routine exam, the nurse reviews the infant's record and finds that the initial phenylketonuria (PKU) test was performed when the baby was 12 hours old. What is the nurse's best action? A. Obtain a repeat blood test at this time. Phenylketonuria (PKU) screening is required by all 50 states. For the test result to be accurate, the infant must ingest some protein from breast milk or formula, which may not be possible before 24 hours. If the initial blood sample was taken before the infant was 24 hours old, it must be repeated by the 3rd week of life. A heel stick is usually done 24 to 72 hours after birth. If a baby is born outside a medical setting or if the baby is discharged prior to 24 hours, the nurse should instruct the parents to make an appointment for the test as soon as possible. Some states require a routine second PKU test 1 to 2 weeks after birth. Question 13. Which developmental age group is most likely to regress when ill? C. Toddler. Toddlers are likely to regress when ill, when learning new skills, during times of stress, or from a change of routine. With fewer coping skills than older children or adolescents, toddlers seek comfort in the same way as when they were babies. Question 14. Assessment of a primigravida in active labor reveals cervical dilation at 9 cm, 100% effacement, and the fetus at +1 station. The medical resident orders meperidine 50 mg IM for the patient. What should the nurse do? A. Refuse to administer the medication to the patient. The nurse should refuse to administer the medication because of the risk of respiratory depression in the neonate. Meperidine IM peaks in 30 to 60 minutes and is effective for 2 to 4 hours. Based on the most recent assessment, the patient will likely give birth within that time frame. Naloxone should be readily available whenever opioids that can result in respiratory depression are administered. Question 15. 2 toddlers are arguing over a toy truck in the playroom. What should the nurse say to the children? B. Let's see if we can find another truck so you'll each have one to play with. Sharing is an advanced concept that requires an understanding of possession and the ability to wait until the toy is returned. Toddlers have not developed the concept of sharing, so 2 similar toys should be provided to prevent unnecessary arguments. Playing together is also beyond the developmental level of a toddler. They may play side by side but not cooperatively. Threatening or taking toys away does not work. Question 16. An LPN/LVN tells the RN that a client wants to quit smoking. Which of the following tasks can the RN delegate to the LPN/LVN? C. Apply a nicotine patch on the client. The LPN/LVN is able to administer medications, including a nicotine patch, as well as provide standard information that would come with the patch, such as how to apply it. The other options are variable methods of client education, which are the responsibility of the RN. Question 17. A nurse has instructed a 52-year-old female Caucasian client about postmenopausal osteoporosis. Which of the following statements by the client would indicate that the nurse should provide more education? A. I'm glad that I have a low risk of getting osteoporosis. Small-boned, fair-skinned females of Northern European heritage have the greatest risk of developing osteoporosis. The other statements are true. Question 18. When caring for an older adult, the nurse may see an increase in C. Urinary retention. Urinary retention can be caused by a weak bladder muscle, an enlarged prostate, medications, nerve damage, or constipation. Treatments vary by cause and can include medication, exercises, surgery, and catheterization. Question 19. A client with type 2 diabetes has a glycosylated hemoglobin HbA1c level of 9.1%. What sort of plan should the nurse make for this client? A. The nurse must create a plan to help the client manage poor glucose level control. Glycosylated hemoglobin, HbA1c or A1c, is a measure of the average glucose level for the previous 3 months. A normal level is below 5.7%, prediabetes is 5.7–6.4%, type 2 diabetes is diagnosed at 6.5%. A level of 9.1% shows that this client's disease is not well managed. The nurse can assess the situation and create a plan that includes improved self-care and compliance. Question 20. A 3-month-old African American male is being assessed during his routine checkup. The nurse notes a dark blue pigmented mark across his back and buttocks. What should the nurse do? B. Document the observation in the infant's record. Dark-skinned infants, African, Asian, Indian, and Mediterranean descent, often have Mongolian spots, which are flat, dark blue or blue-gray, and irregularly shaped. They can occur anywhere on the body but most often on the back or buttocks. They can be small or large. They usually fade by age 5 or 6. Question 21. A 3-year-old is being hospitalized for surgery. Which intervention will be most helpful to help the child adapt to staying in an unfamiliar setting? C. Having a parent or caregiver stay with the child. Parents or caregivers should be encouraged to spend as much time as possible with their child. They can help with care, provide comfort, and explain what is happening. Bringing a blanket or favorite toy is very useful, but not as effective as a loving person. Age-appropriate toys and other children are beneficial, but not the most important. Question 22. During a routine prenatal appointment, a client who is 6 months pregnant states she has constipation. To relieve this condition, the nurse should instruct her to C. Increase fluid intake to 3 liters each day. Due to increased levels of progesterone during pregnancy and NBSB, constipation can be caused by decreased gastric motility and increased water reabsorption in the colon. Increasing fluid intake to 3 liters a day will be helpful, along with adding more fiber to the diet. If tolerated, extra exercise will also help prevent constipation. Laxatives can cause abdominal cramping. Mineral oil can interfere with absorption of fat-soluble vitamins A, D, E, K. Prenatal vitamins and iron supplements are necessary and should be continued. Question 23. ROGAM is most often used to treat space, mothers that have an space, infant. C. Rh negative, Rh positive. ROGAM prevents the production of anti-Rh antibodies in an Rh negative mother who has an Rh positive fetus. Subsequent pregnancies, specifically the baby's RBCs, will not be seen as foreign by the mother's immune system. Question 24. The nursing instructor is observing a student assigned to a postpartum client with a diagnosis of human immunodeficiency virus, HIV. As the student assists the client in caring for her infant, which action by the student requires the instructor to intervene? B. The student helps the baby latch onto the mother's breast. Mother-to-child transmission can occur during pregnancy, birth, or breastfeeding. In the United States, where mothers have access to clean water and affordable replacement feeding, infant formula, CDC and the American Academy of Pediatrics recommend that HIV-infected mothers completely avoid breastfeeding their infants regardless of antiretroviral therapy, ART, and maternal viral load. Wearing gloves is a standard precaution when dealing with body fluids and excretions. The umbilical stump should be kept outside the baby's diaper. To help prevent sudden infant death syndrome, SIDS, the baby should be placed on its back to sleep. Question 25. A female client asks her healthcare provider about the benefits of receiving the human papillomavirus (HPV) vaccine. Which statement is the most appropriate response by the healthcare provider? B. The HPV vaccine can help prevent cervical cancer. Over 100 different types of HPV have been identified. HPV is the most common sexually transmitted disease, STD, in the United States. Cancer is the most serious complication of HPV. The vaccine is effective in preventing cervical cancer associated with certain types of HPV, but it does not protect against all HPV types. Regular cervical screenings are recommended. The vaccine is given in a series of 3 injections over 6 months. Question 26. A mother who has been exclusively breastfeeding her baby for 6 months asks the nurse about additional nutrition for the infant. What information should the nurse provide? B. Gradually add cereal and cured meat. The American Academy of Pediatrics recommends and NBSB, breastfeeding and NBSB, or formula as the sole source of nutrition for about 6 months. And NBSB. After that, it may be time to add more nutrients, protein, iron, and zinc. These are found in iron-fortified cereal and cured meats. Single-ingredient foods without salt or sugar should be introduced one at a time, 3 to 5 days apart, to assess if the baby has an adverse reaction, such as diarrhea, vomiting, or rash. Breastfeeding or formula should be continued until the baby is 1 year old. Fruits, puddings, and desserts are not appropriate for infants. Finger foods do not supply necessary nutrients. Question 27. A female client phones the OB/GYN clinic nurse to ask for help figuring out when she ovulates. The client states that her menstrual cycle is 32 days. During which days of her cycle will she likely ovulate? C. Days 17 to 19. For a female with a regular menstrual cycle, calculating ovulation is simple. Ovulation occurs 14 days before the onset of menses. For this client, ovulation will occur on about day 18. There are about 6 to 8 days during each menstrual cycle when a female can get pregnant, starting about 3 to 4 days before ovulation and 3 to 4 days after. This is called the fertile window. Question 28. When her pregnancy is confirmed, a 28-year-old client becomes worried about being physically uncomfortable. She tells the nurse, "I'm not sure I want to be pregnant." What does the nurse understand about the client's statement? C. The client is experiencing ambivalence about being pregnant. Ambivalence about pregnancy is normal even when the pregnancy is planned and wanted. It is typical of the first trimester. By the start of the second trimester, the client will likely accept the reality of being pregnant. The client is not expressing fear of the outcome or a desire to end the pregnancy. Question 29. A 13-year-old has just started to menstruate. Which statement should the nurse make during client education? B. You can take a mild analgesic if you get cramps. Taking a mild analgesic such as ibuprofen is appropriate to relieve any discomfort. The temperature of food has no effect on menstruation. Exercise should be continued. Tampons may be used as soon as the adolescent feels comfortable inserting them. Slender tampons may be easier to wear because they are smaller. Question 30. A 26-year-old client comes to the birthing center in early active labor. She is full term and membranes are intact. The nurse locates fetal heart sounds above the client's umbilicus at midline. The nurse should continue to assess that the fetus is in which position. C. Breech. Breech position is indicated when the fetal heart sounds are near the top of the uterus, above the umbilicus. In the cephalic or face position, fetal heart sounds are heard on either the right or the left side of the uterus, below the mother's umbilicus. Transverse position is indicated when fetal heart sounds are midline and below the umbilicus. Question 31. A nurse is assessing a new client who is being evaluated for hepatitis C. Which question should the nurse ask? D. Have you ever gotten a tattoo? Hepatitis C is a blood-borne virus. It can be transmitted by contaminated needles used for tattoos. The most common means of transmission is sharing needles or syringes to inject drugs. The other options are questions about hepatitis A transmission. Question 32. The nurse reviews recent lab results with a new client. Which elevated test level is most important for the nurse to address to reduce the client's risk of coronary artery disease, CAD? D. Low-density lipoprotein. Low-density lipoproteins, LDL, are directly associated with coronary artery disease, CAD. Along with cholesterol levels, LDL levels have a higher correlation with the risk of developing CAD than triglyceride levels. Glucoamylase is a digestive enzyme. Question 33. The community health nurse is teaching a smoking cessation class. 2 pregnant clients are enrolled. Which information is most important for the nurse to include during the class? D. Smoking during pregnancy increases the risk of preterm birth. According to the CDC, smoking during pregnancy increases the risk of preterm birth, low birth weight, birth defects of the mouth and lip, and sudden infant death syndrome, SIDS. Nicotine reduces placental blood flow and may contribute to fetal hypoxia. Nicotine in any form is harmful. Electronic cigarettes, vaping, deliver less nicotine but have chemical propellants. The placenta does not block nicotine. Question 34. After assessing their speech development, which of the following children should the nurse refer for further evaluation? D. An 18-month-old boy who only says no. By 18 months, a child should be able to say several words. The child should also be pointing at objects they want or at pictures in books. Lack of speech development can indicate a lack of social stimulation, a hearing deficiency, or a developmental delay. When a child seems to be lagging in language and cognitive development, further evaluation is recommended. Question 35. The nurse is planning activities for elderly residents in a long-term care facility. Which of the following activities will be most effective in meeting the growth and development needs of a person in this age group? D. Reminiscence therapy. Reminiscence therapy is defined by the American Psychological Association, APA, as the use of life histories, written, oral, or both, to improve psychological well-being. The therapy is often used with older people. According to Erickson's 8th stage, Integrity versus Despair, older adults, 65 years to death, need to find and accept the meaning of their lives, otherwise, they may become depressed, angry, and afraid of dying. Reminiscing contributes to successful adaptation by maintaining self-esteem, reaffirming identity, and working through loss. Question 36. During her 3rd trimester of pregnancy, a client attends a class on breastfeeding. How many additional calories, call, per day should a healthy nursing mother consume? D. 350 to 400 call day. According to the CDC, breastfeeding mothers generally need more calories to meet their nutritional needs while breastfeeding. An additional 350 to 400 kilocalories, call, per day is recommended for well-nourished breastfeeding mothers, compared with the amount they were consuming before pregnancy, approximately 2,000 to 2,800 kilocalories per day for breastfeeding women versus 1,600 to 2,400 kilocalories per day for moderately active, non-pregnant women who are not breastfeeding. Question 37. When a nurse meets with a pregnant client to teach her about prenatal nutrition, what is the nurse's first step? D. Ask her to keep a food journal until her next appointment. Assessment is always the first step before planning or conducting any education for clients or their families. The nurse should gather information about the client's current diet and eating habits. Building on that, the nurse can suggest changes that fit with the client's lifestyle. The nurse will also want to assess the client's ability to afford nutritious food, and make a referral to a social worker if assistance is needed. Question 38. A client with a new diagnosis of type 2 diabetes has been placed on metformin 500 mg PO/bid, as well as a 1,600 calorie meal plan. The client tells the nurse that they prefer to skip breakfast to save calories for later in the day. What is the nurse's best response? D. Eating breakfast will help you avoid eating too much later in the day. The client should stick to a daily schedule of meals and medications. This includes having a healthy breakfast. The best breakfast is one that is high in fiber but low in added sugar, carbohydrates, and salt. Eating the same amount, especially carbs, at the same time helps maintain a steady glucose level. Balanced meals include protein and fiber. Meals and snacks should have the same amount of carbohydrates. Typically, the client should eat within 1 to 1.5 hours after waking, then have a meal every 4 to 5 hours after. Snacks can be eaten between meals and at bedtime. Question 39. When a mother enters the playroom of the pediatrics unit to visit her 3-year-old son, he does not immediately go to her. What is the reason for his behavior? D. The child is displaying normal behavior. When young children are separated from their parents, the phases they go through include protest, despair, and denial or detachment. In the stage of protest, when the parents return, the child readily goes to them. In the despair stage, the child may not readily approach them, or may cling to a parent. In denial or detachment, when the parents return, the child is cheerful and interested in the environment and new people. The child may even be unaware of the parents, or being friendly toward the staff. Question 40. The pediatric nurse is assessing a 5-year-old child for lead poisoning. Which finding will indicate the need for further follow-up? D. Visual motor problems. Lead poisoning occurs when lead builds up in the body, often over months or years. Even small amounts of lead can cause serious health problems. Children younger than 6 years of age are especially vulnerable to lead poisoning, which can severely affect mental and physical development. Neurocognitive indications include developmental delays, lowered intelligence quotient (IQ), reading skill deficits, visual spatial problems, visual motor problems, learning disabilities, and lower academic success. Signs and symptoms of lead poisoning in children also include hearing loss, irritability, loss of appetite, sluggishness and fatigue, abdominal pain, vomiting, constipation, and seizures. The other 3 answer choices are not associated with lead poisoning. Question 41. At her first prenatal appointment, the client states that her last menstrual period began on February 5, 2017 and ended on February 10, 2017. Using Nclex rule, her estimated date of delivery is D. November 12, 2017. Nclex rule, also called Nclex rule, is a simple formula. Due date equals LMP start date plus 9 months plus 7 days. Question 42. A client with a history of type 1 diabetes comes to the prenatal clinic with her spouse to discuss the possibility of having a baby. What will the healthcare provider, HCP, tell the couple? D. There is a higher risk of complications and birth defects. Pregnancy with a diagnosis of type 1 diabetes can be healthy, but is usually considered high risk. Managing the diabetes might be harder, so it's important to have good blood sugar control before and during pregnancy. Certain birth defects are associated with diabetes. Many HCPs plan to deliver the baby at 38 to 39 weeks. Although the pregnancy can be safe, it is false to tell the couple that it will be completely normal. Pregnancy does not cause diabetes-related kidney disease, but it can worsen existing disease. Kidney function is closely monitored throughout the pregnancy. Clients with a history of diabetes should seek medical care before becoming pregnant, to ensure optimal health and glucose control before becoming pregnant. Question 43. The football coach invites the school nurse to instruct the team on proper hydration during hot weather. The nurse teaches the athletes to avoid dehydration by D. Taking a fluid break every 30 minutes during practice. The combination of physical activity and hot weather accelerates dehydration. The body needs regular water and electrolyte replenishment, so a short break every 30 minutes is recommended. Drinking fluids before and after practice is a good idea, but this will not maintain water and electrolyte balance during strenuous activity. Salt tablets may not be administered without written approval from each athlete's healthcare provider. Question 44. A 17-year-old unmarried prima gravida who is 9 weeks pregnant tells the nurse that her family doesn't have much money. Her dad just got laid off from his job. Which of the following actions would be most appropriate? D. Refer her to a social worker to enroll her in a food assistance program. The nurse should refer the client to a social worker to enroll her in a food assistance program. Teaching the client to make meals won't help if she and her family don't have any money. Determining qualifications for assistance is the social worker's job. Asking about a job is simply inappropriate. Question 45. A nurse is instructing a 46-year-old prima gravid client prior to a percutaneous umbilical blood sampling (PUBS) procedure. When the client asks why, the nurse explains that it will D. Diagnose genetic disorders. Percutaneous umbilical blood sampling, also called cordocentesis, is performed to determine Rh disease, to test fetal CBC, and for karyotyping chromosomes to detect genetic disorders. It can be done after week 18. It is different from amniocentesis because it does not screen for neural tube defects. However, results are available in a few days, compared with a few weeks for amniocentesis.